appelle à maman.
Là, il a dit qu'il était bien fatigué. Il dormait, c'est pour ça que je suis pas resté trop longtemps. Il était un peu mélangé, il m'a demandé où il était. J'ai dit qu'il était dans une chambre avec des draps. Là, puis, mais il avait l'air tout débalancé. J'ai annoncé que s'il n'y avait pas de complications, il resterait 3 jours. Puis il avait l'air content de ça, il a hâte de revenir, je pense. Tout s'est bien passé. J'espère qu'il n'y aura pas de complications.
Je suis bien content que ce soit fait. J'ai hâte de commencer à marcher puis à faire des efforts. Il paraît qu'il faut que je tousse beaucoup, mais quand que je respire, ça me fait bien mal là. Je ne sais pas comment on va faire, mais en tout cas, on va essayer.
Tout recommencer à neuf, puis se bâtir une vie en santé, puis je sais qu'il veut être musclé, puis il y a bien des projets, bien des projets. On espère avoir un bel avenir.
Patients that we like to operate on are those with the comorbidities of obesity. That is, the diseases that run with the obesity that we would hope to cure as a result of the operation and weight loss. Some examples are type 2 diabetes, heart attacks, stroke, problems with veins, high levels of cholesterol and blood lipids. All of these are very good reasons to operate. And those are the things we would emphasize with the patient. There is a risk to any surgery, and there could be mortality from this operation. It's extraordinarily low, but we must tell patients exactly what to expect.
Okay. Do you have any allergy to the medication? Penicillin?
For what?
Allergy? No, nothing. Are you diabetic? You're not either. Do you have your own teeth? Yes, you do. Why are you coming to the operating room? I know. I'm ready for that. But I just want you to know. Could you explain to me?
Why?
Yes.
To help me lose weight.
Yes, and what they will do?
So they cut me up.
Cup you up? Yes. But why?
Make a chop suey. No, it's going to cut me up and make my stomach smaller.
Perfect. Perfect. Hi. Your friends are here to see you. Can you wake up a little bit? You're awfully tired.
Here you go, dear. No.
Mr. Biella?
Wake up for me.
Can you open your eyes?
Yeah.
Open up.
Yeah, they're here to see you.
You want me to...
Can you talk to them a little bit? How are you feeling? Yeah, you having any pain?
No.
Not very much? That's good, you're in the chair.
It hurts a lot. All kinds of medication. Can't talk properly, everything is swollen. Everything is swollen. My hands, my feet, my legs, my throat. You guys, could you have a feet?
Mr. Bielo, do your best on your own, okay? Because someone hurt their back yesterday.
She hurt her back.
Yeah. Okay, so,
Lifting me up.
yeah, so
And where
just,
did she lift me up?
I don't know, she lifted your leg when you got back into bed. If you can't, move your bum back more and it's going to be easier to bring your legs up.
How do you expect me to do that?
If you can,
Huh. Rub.
yeah.
Rub. Like that
Rub.
I could take a bit of skin off my things?
Well,
Well, what? Hey?
well, I'm not helping you, okay? So you do your best.
Okay, so
Okay.
you know what? So you could even leave.
No, I'm not going to leave.
No,
I'm
you
going
can
to
leave.
watch
You can leave right now. If you're not helping, leave.
Mr.
If you
Bielo,
are not helping, leave.
Mr. Bielo,
You don't want to help. Leave.
I want to help you, okay?
No,
But
you
I'm
don't
trying
want to.
give you ideas on
What
how to get
ideas?
into bed.
But do you know, first of all, it's too high, this bed.
Does it go lower?
We tried, no.
Is there a stool? We can use a stool you could put your feet on.
I don't know.
Back.
Let's try.
Okay.
I'm not staying in this fucking hospital anymore, man. No fucking way.
The public perception is, I think, about to change. And it's about to change because of the rapidity that obesity becomes apparent. And just think of the amount of money we're spending in all the campaigns to stop smoking, etc. Well, obesity is just about to bypass smoking in terms of morbidity and cost to society.
In the past 5 years, there's been a market increase in demand. The waiting list is actually about 1,800 in the various stages. It's an issue, even in children now. And these children become adolescents, and then these adolescents become adults. And then these adults come here. And we want to be able to say to them, yeah, we can help you. The wait time would be 3 months and not 3 years. There's only, I think, 2 large-size wheelchairs in this place, stretchers, beds in radiology, shower stalls, doors going into places can't accommodate some of my patients. This is our scale. It goes infinitely because it's digital. We're trying to get a more modern, less intimidating piece of equipment here. Look at the size of this thing. Look how high it is. My patients can't go up here. It's not a practical means for a 700 or 600 pound person to get on. These people are not overweight. They're morbidly obese. Obesity is an epidemic. It deserves this recognition. It deserves the resources. It deserves the staff. And people to realize that they're people under all that skin.
Antonio is a special case. He is one of the 10% or so people that are the super heavyweights, as we call them. They are a unique and challenging group to treat because the more obese the individual, the higher the incidence of wound infection after the procedure.
Well, I got dismissed on the Sunday, and on the Tuesday I started getting fevers. I went to the emergency, they checked my fever there, and they found that there was a little infection.
He did reasonably well as far as the main procedure was concerned, but he was one of those unfortunate individuals falling in the 20% of the wound infection rate. So his weight loss will be, I think, quite reasonable and successful.
To have your whole life dictated by something that who knows what it is, you know? Is it a childhood trauma? Is it a neuroses? Popular psychology today is that, you know, there has been some trauma in your life that you are compensating for by overeating.
That's bullshit. I don't believe in that. You know, I don't believe in that. That's an excuse. Me, I used to eat because I like to eat. Like, if I like the taste of a steak, I used to like eating one steak and then, so good, I would have another one. But now I can't. I get full with just a bit, you know? Now, what trauma? Where do you get trauma with that? To be or not to be? That is the question. I feel great. I probably lost about 160 pounds. 160 pounds of fat we're talking about here, strictly fat. Amazing, eh? It's crazy. I just can't realize that I was bringing another 160 pounds on me. It's another person. I was bringing him on me all day long. You weigh about 160 pounds?
Yeah, 160 exactly.
A month, 2 months there after the surgery, I felt, you know, started showing you're lighter, so I could have moved more. I sleep comfortable, man. Before I used to sleep maybe an hour and a half. I used to get up, I used to go back, lie down, I used to have to get up, you know. Now I'll sleep those 4 or 5 hours, you know. The day I wake up in the morning, I get up, I get off the bed, you know. It's a whole different thing.
Well, since the surgery, I feel perfectly fine, perfectly healthy, very happy. I've lost roughly 65 to 70 pounds. I don't weigh myself all that often. I tend to just judge by the clothes that I wear and what I'm able to fit into. I used to think when I was walking down the street, people were looking, going, oh my God, look at the fat girl. Not that I was conceited thinking that people were looking at me, but it was just a complex that I had. But now I kind of, you know, hold my head up a little higher, and if I see somebody looking at me, I'm thinking, well, maybe they're actually thinking I look good, as opposed to thinking that I look bad.
Hey, salut Alec. Hello. Ça va? Oui. Tu sais comment j'ai maigri? Ouais, beaucoup, hein. Ta-da-da! Regarde le changement, c'est mes anciens pantalons, ça. Regarde bien ça. Je me sens beaucoup mieux. Beaucoup mieux. Moi, je peux te dire ça. C'est 110 livres de moins, ça paraît beaucoup, là, sur ta forme physique et autres, là. Je pesais 332. Ça fait 111 livres depuis le 21 janvier. Je suis content. Oui, je me sens comme un être humain, là, pas comme une personne qui te regarde. Hey, il est bien gros, lui, hein? Ah. C'est vrai, il y a beaucoup de jugements, tu sais, envers les gros. Mais aujourd'hui, non, je vois pas ça de même, pas en tout. Puis, j'ai la tête plus haute, là.
someone were to come up to you and be like, I'm thinking about having
Yes.
gastric bypass surgery, what would you say to them?
Do it. Go for it. Do it. It's your life, man. You can't continue living like this. Unbelievable. Look how many ducks. Look, that's the whole family. Look. Mother, father, sister, grandfather, mother, kids, everybody. Everybody. Oh, it's hard. It's hard to tell that obesity is a sickness, which it is. But a lot of people, they don't know. They think, he's just lazy, you know? Fat, lazy. Lazy fat, you know? It's prejudice. Laying down prejudice, which is ignorance, you know? Just because a person is fat, though, it's because he let himself go. Maybe he did. Maybe he didn't. But, hey, a person that does drugs, he's letting himself go. An alcoholic is, they're all sicknesses. And obesity is a sickness, too.
People have to be more aware that there's a need. There's a need, and we are experiencing this need. Obesity is an epidemic, and an epidemic is a disease. And no one wants to acknowledge this disease.
Vas-y, puis moi, je l'appuie à 200-300%. Là.
Ça va à peine.
Ouais.
Voir qu'est-ce qui arrive après, là, puis qu'est-ce que c'est avant. Là.
Ta vie change, hein. Puis pas juste le poids, partout. Même le monde te voit pas pareil, puis le monde te parle plus, puis le monde a moins peur aussi.
My friends asked me, can I tell so-and-so that you had surgery? And I said, sure. I'm not embarrassed that I had it. I'm actually proud of it. And people are really interested when I tell them, what it is exactly if they don't know. They're fascinated by it. And then I tell them how much I used to weigh and what I used to look like. And they're just shocked. And I just consider myself to be very lucky that everything worked out the way that it did. But I don't take that for granted at all. Like, I know how fortunate I am to have had such a great experience to date with the surgery.
You can try diets. I've tried diets, this and that. I find this is the easiest thing. I eat right, and I'm losing weight, which is awesome, man. And for the future, man, I just want to live. I want to live. I want to be able to walk freely. I want to be able to ride a bike freely. I want to be able to move normally. If I want to go climb a tree, I'm able to climb a tree. But when you're big, you have restrictions. And I don't want those restrictions no more. I just want to be free.